In this example of amplification of denial, we look at a paper that fueled the belief that vaccines cause more harm than good. In December of 2022, this risk-benefit assessment concluded that boosters do more harm than good to young men, adding rocket fuel to the anti-vaccine fire. Just a week after it was released, the state of Florida declared war on the vaccine manufacturers and put the senior author of this paper on a public health integrity committee. That paper appears to have its roots in this opinion piece written almost a year earlier, which called for a risk-benefit assessment while suggesting they already knew the outcome and making the odd suggestion that social scientists, bioethicists, and legal scholars would be the right people to do it. Not only did this risk-benefit assessment reach exactly the predicted conclusion, but it included 5 authors from the original opinion piece. Apparently, the other 4 authors provided the skills needed to do the risk-benefit assessment. So who were these experts? There was a surgeon who chided experts for not telling the public that the pandemic would end in the spring of 2021, an oncologist who had compared those responsible for public health interventions to Hitler's fascists, an epidemiologist who had very publicly declared that kids should go back to school without masks, without testing, and without vaccines. And finally, the person who apparently did the risk-benefit assessment was a self-declared boutique science and technical communications consultant. Normally, one would expect an ethics journal to outsource their epidemiology, especially when there were existing risk-benefit assessments such as this one done by top experts in the UK, which concluded that the vaccine prevented 10 times more hospitalizations than they caused, or this one by the CDC, which concluded that the booster prevented 16 times more hospitalizations than it caused in this age group. The authors don't really consider either of these. Instead, they produced this comparison of risks and benefits. The only benefits of boosters considered was reduced hospitalizations, meaning they ignored any reductions in deaths, in long COVID, in non-hospitalized COVID, which is the bulk of COVID, and COVID severity. Most remarkably, they completely ignored the entire justification for vaccine mandates, which is reduced transmission. On the other hand, they included and often exaggerated every conceivable risk, comparing them directly to hospitalizations. The vast majority of risks do not involve hospitalizations. And when they considered hospitalization, they cherry-picked results, and they routinely ignored controls. To get a sense of these errors, consider just one of these graphs. The vaccine risk estimate was based on this clinical trial. In interpreting the results, the authors ignored almost all the data, which showed more adverse events in the group receiving the placebo than in the group receiving the actual vaccine. Instead, they based everything on these 3 cases. But these cases had moderate, mild, and transient disease. One is rarely hospitalized for mild, moderate, or transient illness, and there is no evidence that they were. If we compare apples to apples and focus on hospitalizations, we see a clear advantage for the booster. Comparing adverse vaccine reactions to cases of symptomatic COVID prevented by the vaccine, or consider prevention of COVID deaths at the rate they were occurring at the time of the study, the advantages of the booster become clear, even without considering reductions in transmission or long COVID. There are a couple of things the authors get right. First, the vaccine policies should consider prior infection. And second, the underlying need for a discussion of ethics of mandates when the vaccines cause harm. But you have to have the best possible epidemiology, which this is not. And you have to consider transmission because that is the reason for vaccine mandates. I count 12 major flaws in this paper. To be fair, all papers have flaws, but if the study is objective, the flaws are random. In this paper, every error either exaggerates risk or minimizes benefits. That's like flipping a coin 12 times and getting heads every time. At some point, you start to worry if you've got a fair coin. To understand the impact of this paper, compare the reception of these two risk-benefit assessments. This one, done by top statisticians, epidemiologists, and virologists, had an attention score in the top 5% of all research papers. But this study had 27 times the attention score, the top paper in the history of this journal. Over a year later, it is still being actively shared on social media, and the state of Florida is still at war with the vaccine. Meanwhile, we know that vaccination rates are closely correlated with reduced COVID mortality. This is a classic case of amplification of denial, where it was conducted by researchers who had already announced what they would find. Those researchers had limited prior expertise in the fields. They had key existing research that was ignored. Conventional media amplified the results. It exploded on social media and was never corrected.